Somewhere on your cat's body right now, there may be a patch of fur that is thinner than it used to be. Maybe on the belly, where you rarely look. Maybe along the inside of the back legs, or down a strip of the lower back. The skin underneath looks almost normal, but the fur is short, stubbly, broken, like someone took tiny clippers to it. And here is the thing that almost everyone gets wrong. The moment people notice this, they say the same word: stress. They decide their cat is anxious, and they stop looking. But what if I told you that in the real world, when veterinarians actually investigate cats that lick themselves bald, the large majority turn out to have a medical reason hiding underneath, and stress is often the very last thing on the list, not the first? I am Dr. Leo Tran, your neighborhood vet, and excessive grooming is one of the most misread signals I see. Today, I am going to walk you through what is really happening when a cat licks itself bald, the 5 real causes in the order they actually occur, the dangerous mistakes that keep cats suffering for months, and exactly how to fix it. Stay with me, because if you only remember one thing from this video, it is this. Your cat is not being dramatic. Your cat is telling you something, and it is usually something you can fix. Let me start with the difference between normal grooming and the kind that should worry you. Because cats are clean animals, and a lot of licking is completely healthy. A normal cat spends a good part of the day grooming. They lick to clean, to cool down, to smooth the coat, to feel calm. That is all fine. What we are talking about today is different. We call it over-grooming or barbering, and the tell is in the fur itself. With barbering, the hair is broken off short rather than truly bald, because the cat's rough tongue is acting like sandpaper, snapping the hairs instead of pulling them out at the root. You will often see it in a very specific pattern. A neat strip down the belly, the inside of the thighs, the forearms. Sometimes a stripe along the back. It is frequently symmetrical, the same on both sides, and that symmetry is a clue. And critically, it tends to happen where the cat can easily reach with its tongue. If you part the short fur and the skin looks calm, that is one picture. If the skin is red, scabbed, broken, or there are open sores, that is a more urgent picture, and that cat needs to be seen soon. Either way, this is your cat working at one spot far more than a healthy cat ever would, and it helps to understand why the fur breaks instead of falling out. A cat's tongue is covered in tiny backward-facing barbs, little hooks made of the same material as their claws. Those barbs are what make a cat's lick feel like sandpaper, and they are brilliant at pulling dirt and loose hair out of the coat. But turned on one spot, over and over, they snap healthy hairs off partway down, leaving that short, prickly stubble. So when you feel a patch that is rough and bristly rather than smooth and truly bald, that is the signature of a tongue that has been working overtime. Now here's the myth I have to break, because it causes more harm than almost anything else in this topic. The myth is that a cat licking itself bald is simply a stressed, anxious cat, and that the answer is to reduce stress and weight. The truth, backed by real veterinary studies, is the opposite of what most people assume. When researchers carefully worked up cats that were brought in for so-called stress overgrooming, the majority did not have a behavioral problem at all. They had a medical one. In one well-known study, only a tiny handful of cats turned out to be purely behavioral, while well over half were found to have an adverse food reaction, an allergy, driving the licking. Purely psychological hair loss, the thing everyone jumps to first, is actually one of the least common causes, not the most. That is why any good vet treats stress as a diagnosis of exclusion. It is what we land on only after we have carefully ruled the medical causes out, never the lazy first guess. So let us go through those medical causes the way I would in my own exam room, in the order they really show up. Let me tell you about a cat named Milo. Strictly indoors, never been outside a day in his life, and his owner was certain, absolutely certain, that it was stress, because they had just moved to a new apartment. Milo had licked the fur off both back legs in a near-perfect mirror image. We did the boring, unglamorous thing first. We tightened his flea control and ran the basic skin tests. Within a few weeks, the fur was coming back. It was flea allergy the whole time, picked up who knows where, and 1 or 2 bites was all it took. The move was a red herring. Milo is the rule, not the exception, and I think about him every time someone tells me their indoor cat could not possibly have a flea problem. Because number one, and the single most common reason cats lick themselves raw, is fleas, and specifically flea allergy. I know what many of you are thinking. My cat is indoors. My cat does not have fleas. I never see them. Please hear me on this. A flea-allergic cat does not need an infestation to react. It can take a single flea bite, one, to set off days of furious, itchy over-grooming, and that flea may be long gone by the time you go looking. These cats are so efficient at grooming that they eat the evidence. They swallow the fleas and the flea dirt while they lick, so you find nothing, and you wrongly cross fleas off the list. This is the number one mistake I see owners and even some vets make. The fix here is simple, and it is the foundation of everything else. Rock solid, year-round, veterinary quality flea control on every pet in the home, indoor cats included. Not the cheap stuff from the gas station, a product your vet recommends. Until that is locked down, you cannot trust any other conclusion. Because number two is allergies beyond fleas, and this is the big one the studies keep pointing to. Cats can be allergic to something in their food or to things in their environment, the same way people get hay fever. We call the environmental kind feline atopic skin syndrome. With a food allergy, the itch is there all year, no matter the season. With an environmental allergy, it often flares at certain times of year. In both cases, the cat feels itchy, and a cat that feels itchy does not scratch the way a dog does. It licks. It barbers. The belly goes bare. Sorting out which allergy it is takes a real vet, because the gold standard for a food allergy is a strict diet trial, feeding a special hypoallergenic diet and absolutely nothing else for about 8 weeks, then watching the fur grow back. It takes patience, but when the bald belly fills back in, you have your answer, and you have a cat that can finally stop licking. Because number three is the one that breaks my heart the most, because it is so easy to miss. Pain. Cats will lick, obsessively, at a spot that hurts underneath, even when the skin on the surface looks perfectly fine. This is called referred grooming, and it is the body trying to soothe a pain it cannot otherwise express. The classic example is the cat that licks a bald stripe right down the middle of its lower belly. To an untrained eye, that looks like anxiety. But that exact location sits right over the bladder, and in cats, bladder inflammation, what we call cystitis, is common, painful, and stress-linked all at once. That cat may be licking because it has a burning bladder. Arthritis is another hidden driver. An older cat with a sore hip or knee may groom that joint raw. So when I see a focused bald patch over a joint or over the bladder, I am not thinking anxiety first. I am thinking, what hurts there? And finding that pain and treating it is often the whole cure. I had a patient named Bella who licked a bald stripe right down the middle of her belly. Her family had tried calming sprays for 2 months, completely convinced she was anxious. But the location told the real story. A simple urine test showed inflammation in her bladder. We treated the cystitis, added more water and enrichment to keep it from coming back, and the licking stopped and the fur grew in. 2 months of treating anxiety did nothing, because the problem was never in her mind. It was in her bladder, and her body was trying to tell everyone exactly where it hurt. Because number 4 is parasites and skin infection beyond fleas, the smaller players that still matter. Mites, like the ones that cause mange or the walking dandruff of Chalatiella. Ringworm, which despite the name is a fungus, not a worm. A bacterial or yeast infection that took hold in skin already irritated by one of the causes above. These are exactly why your vet may want to do a few simple, quick tests in the room: a skin scrape, a tape sample, a look under the microscope, a fungal check. They are not upselling you. They are ruling out the things that look identical from the outside but need completely different treatment. If you are finding this helpful, take 1 second and hit subscribe, because I break down confusing cat symptoms like this every week, and the next one might be the warning sign that matters for your cat. Now, the last cause. Because number 5, finally, is true stress and anxiety, what we call psychogenic alopecia. It is real. It does exist. A cat under genuine emotional pressure, a new baby, a move, a lost companion, a tense relationship with another cat, a disrupted routine, can begin to lick as a way to self-soothe because grooming releases calming, feel-good chemicals in the brain. The trouble is, what starts as comfort can become a habit, a loop, a compulsion that continues even after the original stress is gone. In severe cases, the constant licking creates a thick, raw, ulcerated sore called a lick granuloma that becomes its own problem. But here is the rule I want burned into your memory. We only call it stress after we have ruled the medical causes out. The cat that gets labeled anxious and put on a calming supplement, while a flea allergy or a sore bladder quietly burns underneath, is a cat that suffers for months for no reason. Do not let your cat be that cat. So before I give you the fix, let me name the dangerous mistakes, because avoiding these matters as much as anything you do. Mistake 1, assuming it is stress and stopping there. You now know that is usually wrong. Mistake 2, punishing the cat, yelling, spraying water, pushing them away. The licking is not bad behavior. It is a symptom, and punishment only adds stress to a cat that may already be in pain. Mistake 3, slapping a cone on and calling it solved. A cone stops the licking, you can see, but it does nothing about the itch or the pain underneath, and the second it comes off, the cat goes right back. Mistake 4, reaching for steroids again and again without ever finding the cause. Steroids can calm the itch for a while, but they mask the problem instead of solving it, and they carry real risks over time. And mistake 5, waiting. Over-grooming almost never fixes itself, because the cause is still there. Now here is exactly how to fix it, the right way, in the right order. Step 1, lockdown, flea control, year-round, vet quality, every animal in the house. This alone resolves a surprising number of cases, and nothing else can be trusted until it is done. Step 2, see your vet for a real workup. Let them do the quick skin tests in the room to rule out mites, ringworm, and infection. This is the step people skip, and it is the most important one. Step 3, if allergies are suspected, commit to the plan, whether that is a strict 8-week diet trial for food allergy or a long-term management plan for environmental allergy. Be patient. Skin takes weeks to heal and fur takes weeks to regrow. Step 4, support the skin barrier from the inside with an omega-3 fatty acid supplement, the kind made for cats. It will not cure an allergy on its own, but it calms inflammation and helps the coat recover, and it is something good you can start today. And step 5, only once the medical causes are handled, address true stress. That means a calmer environment and a predictable daily routine, because cats find deep safety in knowing what happens next. It means more vertical space, cat trees, shelves, window perches, and quiet hiding spots where a nervous cat can retreat and feel unseen. In a multi-cat home, it means enough resources to go around, separate food stations, water in more than one place, and the golden rule of 1 litter box per cat plus 1 extra, so nobody has to compete or feel cornered. It means short bursts of interactive play every day, a wand toy, a chase, a hunt, to burn off the anxious energy that would otherwise go into licking. And it often means feline pheromone diffusers, those plug-in calming scents that many cats respond to remarkably well. For stubborn, genuine cases, your vet can discuss anti-anxiety medication, but that comes with a real diagnosis, not a guess. And set your expectations correctly, because this is exactly where people give up too soon. Once you have found and treated the real cause, the fur does not bounce back overnight. The skin needs a few weeks just to calm down, and a full coat can take anywhere from 6 to 12 weeks to grow back in. So do not panic if week 2 looks the same as week 1. What you are watching for first is the licking easing off, then a soft new fuzz coming in, and then the patch slowly filling. That sequence, in that order, is how you know you finally got it right. Before I wrap up, let me bust a few quick myths I hear almost every week. Myth 1, indoor cats cannot get fleas. False, and it is the most costly myth on this whole list, because it talks people out of treating the #1 cause. Myth 2, if I cannot see any fleas, there are none. False, an allergic cat grooms the evidence away before you ever spot it. Myth 3, a small bald patch is no big deal. Not true, it is a little window into something that deserves your attention. And myth 4, if it were truly medical, the skin would look terrible. Often the skin looks almost normal on the surface, while real pain or allergy drives the licking underneath. Let me leave you with the picture I want you to hold. A bald patch on your cat is not a personality flaw, and it is not your cat being difficult. It is a message, almost always a medical one, and it is usually fixable once you read it correctly. The owners who get their cats better are not the ones who guess. They are the ones who start with flea control, who let their vet rule things out, and who treat the cause instead of the symptom. Do that, and most of the time, that fur grows back, and the licking stops, and you get your comfortable, contented cat back. If this changed how you see that bald little patch, do me one small favor and tap the like button, because it genuinely helps me reach other cat owners whose cats are licking in silence right now and getting written off as just anxious. Hit subscribe so you never miss our cat health breakdowns, and tell me in the comments where on the body is your cat over-grooming, the belly, the legs, somewhere else. That location tells a story, and I read every single comment. Until next time, give your cat a gentle scratch somewhere they